My name is Sunday Ediri, the Executive Director and founder of Wellspring Home Care Service Limited. Well, Wellspring Home Care is not a fixed organization, but a combination of functional characteristics which has developed to respond to the emerging need of the population of Nigeria. Wellspring offer health promotion and preventive measures from which older and injured people may benefit in terms of their health and independency. Those who need the service of home care is not restricted to only the old or the elderly, but also the young adult and all those who can afford the services. These patients are usually referred by other healthcare professionals such as the physician, insurance company, and health care facilitators. And through our clinical director, we have been able to monitor closely each of these individuals, and we have approached them. They told us what they have and what they can do when we moment we started our organization. Generally, patients in their old age, they want to be taken care of in the comfort of their home when they can afford it, especially in cases such as psychiatric cases, spine cases, permanent or temporary disability. Over and above, the delivery of healthcare service at all level of the business value chain. In the healthcare sector, most visible part of any country, the healthcare, most especially the home healthcare system, is very paramount. And market research indicate that there is a significant need for quality home care in Nigeria, most especially here in Abuja. Then we have been able to meet with a lot of nurses aid, psychiatric personnel, mental health counselors, home care organization, medication management counselors to speak to each of them, and they are ready to work with us the moment Wellspring Home Care starts. According to a research carried out by World Health Organization, it has been estimated that in 2015, there will be 2 billion people over the age of 60, with 80% of them living in developing countries. The global shift in the urban illness from acute life-threatening infection disease to chronic disability and non-communicable disease will be affecting these people regularly. And statistics has it that in 2011, healthcare alone costs paid to hospital, physicians, nursing home, diagnostic laboratories, pharmacies, medical devices, manufacturers, other players in the health sector value chain consume a whopping sum of 17.9% of the gross domestic product we have in the GDP of the United States. All our We have indicated that all pricing will be set according to Medicaid, Medicaid, and other insurance regulation pricing in major factors that will be considered. Says estimated projected health revenue in the first year and modest increase throughout the 3 years. The unique thing about Wellspring Home Care Service Limited is about our technology. We have decided to use technology to meet the needs of the people in Abuja, Nigeria as a whole and all its environment. Technology in the sense that we want to create an app in a mobile app that will be easy to access for those educated one and even the non-educated one. Tech companies have found a viable solution to problem families often encounter with regard to the availability of home care services. What home care app can do is allow a family to hire help for their elderly for specific needs, such as taking them for a walk, preparing their lunches, or simply keeping them company for a short period of time when the family member have important errand to do outside their home. Through home care service are patient, insurers, caregivers, and agency all benefit, and in the process, quality of care, resource utilization, and care efficiency are all enhanced. Since it has also been expensive for caregivers from time to time, the hourly rate that a home healthcare app offer also proved to be beneficial to most families. Each and every one of our staff will be indicated in the mobile app, most especially those nurses, aid, physiotherapy, speech therapy, mental uh, counselors, and also medication management counselors. All their faces will be indicated in the mobile app. So it is easy for you to just go to Wellspring Home Care Service Limited, click on the app, choose the nurse that you want to treat you, then you request. A driver will come and drop the nurse at your home. And after the nurse is done with you, the driver can come back again, then pick the nurse and bring the nurse back to the office. Or if possible, if there is still much time, the nurse can be taken to the next available client. That's what we intend to do. Then we have met with all the mobile network, MTN, Airtel, Nine Mobile, Glo. We have met with them and we've discussed about having a toll-free line so that it is easy for everybody to just dial our toll-free number, just like what you have in the United States. You have 911. It's easy for you to dial 911 and somebody is there to respond. We have media. We tend to open a media team, an office whereby when you call, somebody is always there to answer. And in the satellite town, the full zone we have in the satellite town, we are going to station ambulances, a kind of emergency ambulance in those places. So if it is a kind of quick response you want, or you are very, very sick and you needed help urgently, whichever person that is close, we tend to send that person to pick you. Or if there is a nurse that is with the person, the nurse can give you the first aid treatment before taking you to the hospital. So that's beautiful thing. From our toll-free line, you have a BVN. For those of them who cannot register through the app and they call our toll-free line, because of the link we have with the BVN company, your address that you are using will show on our database. So we can quickly call our nearest ambulance to go to, let's say, a place. It will say, pick somebody, take the person to the hospital. Then, in that case, you have saved a life. So these are the things we intend to do. This is the unique thing that no home care service has ever done, and also here in Abuja, no home care service. If there is, we think that it has not happened. So we actually want to do this thing to ease the burden they have in the hospital, ease all their burden, because a lot of people who has headache, who want treatment, they will go to the hospital. Whereas they were supposed to go to the health center for treatment, they will go to the hospital. So we want to decongest what they have in the hospital. As a matter of fact, we tend to do this and make Wellspring Home Care Service Limited a state-of-the-art home care. So, for the now, our Wellspring Home Care is still in the startup stage. Our organization will be located in the heart of Abuja, Nigeria. Wellspring Home Care Service is in the business of ensuring that our patients, clients, are well treated, taken care of in every way they want. We have decided that we will make it something that the client will request for you again. So, and we have included a lot of things in our organization. For those who actually need the services that will be carried out by highly trained professionals, such as nurses, nurses aid, mental health counselors, we have medication management counselors, physical therapists, county age workers, rehabilitation counselors, home health caregivers, and home givers who know what it takes to give our highly esteemed customer value for their money. These are the people that we'll be working with. And these are the home care service that Wellspring Home Care will be offering, just like I have counted. The skilled nursing, nursing aid, social work, occupational, physical, and speech therapy, personal injury case, home medication management, personal assistance services. Then there is this key to our success. We want to give professional quality service, then reliability, being available through call and adequate staffing, effective collaboration with other community professionals such as physician, hospital, and or other organization. Well, yes, right now we have our team ready to go to action. Wellspring Home Service initial team will consist of the executive director, one clinical director, three employees, and a contracted agency to fill the need for physical therapy, occupational therapy, and speech therapists. Initially, both managers will provide direct services. Then we have the person of Mrs. Cynthia Ifeanyi. She is a licensed social worker and will provide all social work service during the startup stage of the business. We have Dr. Tega, who is our clinical director, is the CEO of the Tegas and Co. Medical Hospital. Is a medical practitioner. Then we have Mrs. Patience Umayang, is a registered nurse, a skilled registered nurse and midwife. Also, we intend to use her as the person who is going to train most of the nurses and this that we will be having from time to time before we go into foreign training. Then we have Mrs. Anointed Udom. She is the one who's going to will be responsible for the day-to-day maintenance of the activities, administrative work in the office from time to time, and also act as HRO for hiring of more personnel into the organization. Okay, so she will also provide direct nursing service during the initial stage of the business as well as supervising the nursing staff. As the need for service providers grow, both managers will assume primary role in the management and will delegate direct service to employee. Wellspring Home Care Service has no current management or personnel gap. Our plan provides for hiring services provider only when growth has occurred. And as a matter of fact, the way we are going to experience a lot of growth because we tend to expand from Lagos to Kano and Port Harcourt. Then later we will include some other destinations because a lot of people are going to need our services and we are ready to each give them our services. Then, when you ask how much we really need for our startup stage, with all what we have in mind, we will need nothing less than 30 to 40 million naira. If we can have this, we will build the state of the art home care service in Abuja and its metropolis. Okay, we have projected a turnover of 625 million naira due to the number of patients that we will be having from the medical insurance company, physicians, and some other individual. This number is going to increase from time to time because, as a matter of fact, we have a lot of people in the hospital who are just lying there waiting for doctors to come and treat them, whereas they can be treated in the comfort of their home. With the nature of the pricing we are going to give to them, it will be easy for us to get the numbers that we have projected. So we tend to use the money for business development. One beautiful thing about this business is constant advert everywhere. We most in the south, south, southeast, and west. Then some parts of the north central and northwest. We will be putting our adverts in those places. Social media, handle everything to make sure that then we will do direct marketing, placing our banners in different strategic places in the airport. We'll put our flyers in the banks and in the government parasitas. We have a lot of people that their family are somewhere. They cannot look after them because there is nobody at home to look after them. So, like I said, Wellspring Home Care will come, look at your family, your mother, your brother, your child from 8 a.m. or 7:30 a.m. till 5 p.m. that you will come back. Play with your mother, take good care of your mom. Then when you return back, then the vehicle will come and pick that nurse aide and bring that person back to the office. Then we have renter. As a matter of fact, we don't have the budget to build an apartment, so decided to rent a building. It could be a four-bedroom bungalow that we're going to use. Then we have office supplies, office equipment. We have internet. We have mobile app. Like I said, the toll-free line will be paid for by the company, not the mobile handlers. We have BVN service that we have already talked about. Then fair office equipment, like I said, nursing supply. We stay for our first aid. Then office vehicle, we tend to have four vehicle that will be stationed in a place like Gwagwalada, Karo, Zuba, Kubwa. That one will serve those areas so that in case of emergency, and each of these vehicle will have a driver, one social work, and nurse aid just parked there. So in case of emergency, these people can just swing in, attend to the nurse. While after everything you register through our app, you're already a member of Wellspring Home Care Service Limited. So, and each of our staff will be given phone that they can use to communicate all the time. We will be we're recharging the phone for them also. Then we have ACs and lights in the offices. We want to make it a state of the art organization. Okay, internet access steady. We have professional liability insurance, also premises are content insurance, advertising, like I said, advertising and marketing. Then entertainment, maybe like coffee, tea, and the rest. So we have contracted therapists. For the now, we don't intend staffing those people because we can't pay them. So what we can do is to contract them. So, and also the nursing supply. Then we'll have professional development. Each and every one of our nurses that has not gone through training will try as much as possible to register them for training, and so that they can take care of themselves very well and the organization. Well, thank you so much for your time. I do appreciate and look forward to the next stage. Bye.